It's time to get started. We want to welcome you to Reducing Risk Factors for Youth Substance Misuse on the Road to Prevention Success with Chris Reed. This presentation was prepared for the Great Lakes PTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services. Got a few housekeeping items for you. If you have technical issues, please individually message me, Rebecca Buller, or Alyssa Qualla in the chat section, and we'll do our best to be helpful. If you have questions for Chris today, please post those in the Q&A section at the bottom of your screen. If they go in the chat, we can lose them as it scrolls by, and they're important to us, so please put them in the Q&A. If captions would be helpful, use your Zoom toolbar near the bottom of your screen and choose Live Transcript. AI note takers are not allowed in our trainings, and you will be removed from the webinar. And certificates of attendance will be sent via email to those who attend the full session. And now I'm going to turn things over to Chris Reed, who is the co-director of the Great Lakes Prevention Technology Transfer Center.
Hello, welcome everyone. Thank you, Rebecca, for getting us started here. I'm going to go ahead and pull up my slides. All right. Great to be here with you today. And I know a lot of you have a lot of snow. I'm seeing in the chat, lots of snowy places around. I'm curious who's winning the amount of snow. I know, Alyssa, I think you said that you have 10 inches of snow. Anybody got more than 10 inches of snow on the ground today? I've seen a reaction of that'd be pretty wild. Oh, Michigan, 12 inches. 2 inches in Missouri, 12.4, Alyssa. Okay. So we just jumped right into winter for a lot of us, huh? I still can't quite wrap my head around that we are actually in December, but we really are. So I have to remember that. All right. Well, let's dive into this. Our path for today, what we are going to be covering is I'll first do a quick introduction into risk factors and kind of the science behind them, what we're talking about when we talk about risk factors, et cetera. Then we're going to take a deep dive into the risk factors, looking at them one at a time to make sure there's a really clear understanding of what we mean by each of these risk factors. And then we're going to wrap it up by talking about how we can put this information into action. And halfway through, this is a 2-hour session. Halfway through, we will have a 5-minute break. So just to know that you will get a little break halfway through. All right. Hopefully you all downloaded the participant workbook from our website. There was an email that was sent out yesterday if you had registered by then. So if you haven't, it's going to be put in the chat right there. Alyssa just put it in there that you can download the workbook from our website. I'm going to be sharing a lot of information with you today, so I want to make sure you have that workbook to refer to, and then you can also, of course, jot notes in there, or you also have the PowerPoint slides for today, so you can print those out and take notes there, or refer back to them at a later date. I would love to see how many people have been able to download this workbook. If you could do some kind of emoji, you have a thumbs up, heart, anything. All right, I've seen a few, and yeah, we're putting in the chat. Katie, it's great to see. Lots of thumbs up. Okay, great. That is a good sign. Just wanted to make sure folks have access to that. Great, great, great. Thank you for letting me know. All right, and if you haven't downloaded it, you can go to that link that Alyssa put in the chat, and you can download it now if you would like to. All right, let's move along. One quick warning, I will have some pop quizzes coming your way. If you were here with me during the Protective Factors training webinar last month, you will be familiar with these, and we're going to go ahead and do some more of those today. All right, so let's delve into risk factors. as we're thinking about risk factors, I want to make sure you understand the context under which I'm going to talk about these things today. We are going to be talking about primary prevention. So if you were in the presentation with me in the last session, you will be familiar with this slide, but if you think about prevention in other areas of our lives, primary prevention, you can think about the device that you are on right now likely has antivirus software, or hopefully it does, and it helps prevent viruses from coming to your computer at all. It doesn't take care of them after you have a virus. It's helping prevent them in the first place. Similarly, a lighthouse on the coast somewhere is going to help prevent shipwrecks instead of it doesn't take care of shipwrecks after they happen, prevents them from happening. Sunscreen prevents sunburns, and immunizations helps prevent diseases. So in similar ways as these things, we are talking about substance misuse prevention in the primary prevention aspect today. So preventing substance misuse from it ever starting. Now, is it important that we have treatment, recovery in those areas? Absolutely. But we're going to be focusing on this piece of the areas that we need to focus on today. If you like definitions, here's a definition for you, and I'm talking about prevention today. This one's from SAMHSA's Center for Substance Abuse Prevention. We have the proactive process of empowering individuals and systems to meet the challenges of life events and transitions by creating and reinforcing conditions that promote healthy behaviors and lifestyles. I would love to see in the chat, what are some key words from this definition when we're thinking about primary prevention? What are some of the key words in here? If you can put it in the chat. Absolutely proactive, definitely. Yeah, proactive means we're doing something before a problem ever happens. I see empowering, reinforcing, creating. Yes. Are there a lot of really important words in this definition? Yes. So, well, it's kind of wordy. I mean, in terms of lengths of definition, it is a wordy definition, but there are so many key words in this definition. And that's why I like it so much. Of all the different things that when we're thinking about doing primary prevention, these are the things that we're doing. We're being proactive. We're empowering individuals and systems. We're helping people meet the challenges of life events and transitions. We're creating and reinforcing conditions that promote healthy behaviors and lifestyles. So we are doing a lot of things when we're doing primary prevention, and many of those are captured in this definition. So hopefully that helps you as well in terms of really encapsulating what primary prevention is. All right, so we can talk about doing primary prevention and the importance of doing it, but what do we do in order to do prevention, and how do we do it? So if many of you use probably some kind of strategic planning process, there might be the SPIF, the Strategic Prevention Framework, there's Communities That Care, there's other types of public health strategic planning frameworks. We use those kind of frameworks to help identify the problems within our communities. So if you're using the SPIF, the Strategic Prevention Framework, the first step is your needs assessment. We collect data, we figure out what's going on within our community, where the problems lie within our community. However, just knowing that, like if we know that underage drinking is a problem within our community, or we know that vaping is a problem within our community, that does not give us the roadmap to what we do about it. How do we actually do the primary prevention? It's kind of similar. I was thinking about this yesterday, and it was similar to I got my last or a couple of times ago my water and light bill, and my water consumption went way up. And I was like, wait, what's going on? What's up with this? I called our water company and said, this has increased a lot. What's going on? And they're like, don't worry about it. It's just a little increase, compared to other people. I'm like, no, I see a problem here, in terms of this assessment. So they come out and they like, oh yeah, you do have a leak somewhere. I was like, okay, helpful to know I have a leak, but not helpful that you can't tell me where the leak is at. So similarly, when we do our needs assessment, we can identify that the problems exist, but that alone doesn't tell us how to go about addressing that problem. Turns out with my water leak, I had to do a lot of digging because it was outside of my main water line. But that's beside the point. But it does take digging, right, into what's going on in our communities to figure out what is going on behind those problems and how we actually address them. And that's where risk factors really come into play with our prevention work. So, what's often done in our communities, and when we find out we have these problems, we have underage drinking, vaping, might be opioid misuse, it might be cannabis misuse, etc. It could be different things, obviously, in different communities, but it's what happens in the next step. What's often done when we find out that we have these problems in our community? Go ahead and put in the chat what can often happen in communities when we've identified a problem and don't necessarily take the next step to look at risk factors. What do people often do? What do communities often do? Any ideas? Put it in the chat. Deny there's a problem. Yeah, your data's faulty, right? There could be stigma around it, blaming someone. Oh, it's just those people. Yep. No accountability, pointing fingers. Lots of ideas here. Want to do something but not sure what to do sometimes. Yep. Yeah, absolutely. Sometimes ignore it. Yes. Other things, and I'm not sure if it's going pretty fast. Some people might have said it, but often what we do is we collect all this data and we find out what the problem is, and then it's time to figure out what to do in terms of what prevention efforts we want to put in place. We often put in place what people like to do, what they think is good to do, what's always been done, like traditional things that have been done in years past. So without really delving into what things are leading to this increase or leading to this problem within our community. Absolutely. Thank you for all your thoughts, because yes, all of those things you put in there often happen at this point in the planning process. So when we think about prevention and designing efforts to put into place to address the problems that we've identified for our needs assessment, I want to take a sidestep here and think about how prevention in the past, so this is in 2024 fiscal year numbers, received about 5% of the federal drug demand reduction funding. Now that's not much money compared to the rest. So of all the drug demand reduction types of efforts within that federal government is funding, prevention gets only 5%. So when we think about what we are going to do when we implement our primary prevention or use our primary prevention dollars, we need to be really careful, first of all, that we're actually doing primary prevention, that we aren't doing something in the other area of the continuum of care. Yeah, we aren't delving into treatment or recovery again. Not that those aren't important, but if we only have 5%, we need to make sure we're spending it on this part of the continuum of care. And we need to make sure we're spending it well for the most maximum impact. With this small amount of money that we have for prevention, it's even more important that we are as impactful as we can possibly be. So, how can we maximize our effectiveness becomes the question. We can maximize our effectiveness by reducing risk factors that we know increase the likelihood of substance misuse and increase the protective factors that buffer the impact of risk factors. Now, I'm curious, go ahead and put in the chat if you were here for the webinar in I'm losing track of months, in November, protective factors. Were you able to hear? Yes. I've seen yes, 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 or you can do thumbs up. Yep, that's fine to do. Thumbs up emoji. What do you think? Let's see how many folks. Seeing some no's. Okay, some yeses and no's. So it's a mixture. So if you were not able to attend, I highly recommend that you watch the recording of it. It's available because when we're looking at preventing substance misuse, we need to do both. We need to reduce risk factors and we need to increase protective factors. Again, that small amount of money that we have, we are going to be most impactful if we can do both reducing risk factors and enhancing protective factors. So if you didn't get a chance to watch it, participate in that webinar, please go back and watch that when you get a chance. All right, so thinking more about risk and protective factors. I know if you were on the protective factors webinar, we did this, so let's see how you do. When you look at this picture, put in the chat, what do you see in this picture? Go ahead and put in the chat. What do you see? All right. Okay, so we're seeing a mixture. So some people are seeing an older woman, some people are seeing a younger woman, and some people are seeing both. So let's make sure everybody can see both. I'm going to help you out here. So the younger woman is looking like this, kind of looking down, and we see her profile. And this is her cute little pert nose right here, and her eyelashes are right there. And this is her ear. And that's defining her chin here. So she's kind of looking down that way. Go ahead and put, if you can see the young woman, or why don't you put if you can't see the young woman yet. Otherwise, you can do a thumbs up emoji. Everybody seen the young woman now? All right. I've seen lots of thumbs up. Okay, great. All right, it looks like everybody's seen the young woman. So let's go ahead and do this for the older woman. So the older woman is looking down like that. She has a very prominent chin right here, and these are her lips, and this is her nose, and this is her eye. So again, she's looking down like that. Everybody give me a thumbs up or a yes if you can see the older woman. Everybody's, you see it, but it's creepy. Sorry, Danica. All right. Still can't see her. Okay, so this is her hair up here. It looks like kind of curly hair, and that's her eye. And you can only see one side of her face, I should say. So it should be like that. So there's her eye. Whoops, there's my cursor. There's her eye and her nose, and she has a very prominent nose here. And those are her lips, and this is a prominent chin down here. Okay. Anybody else? Okay, can see it now. Gotta kind of squint. All right, so maybe squinting is helping. Yes, kind of like a witch. Yeah, she does have kind of more of a witch kind of like stereotypical kind of look. Yes. All right. Oh, yes, but in a Pablo Picasso style. I just saw that, Mario. I like it. All right, so everybody sees both. I'm going to go ahead and back it up here so we can see, based on how you're looking at the picture, you can see a young lady or an older woman, and you can kind of go back and forth. Now, as you may have already guessed, the reason why I put this up is it's very similar with risk and protective factors. Risk and protective factors create the picture of what's going on in terms of the likelihood of substance misuse in our community. And we have to look at both. We're going to focus on risk factors today, and we're going to take a deep dive into risk factors. But please remember that the other half of the picture is protective factors. So if we are going to see the whole picture, we need to look at both risk and protective factors. So kind of keep that in the back of your mind as we're going along today. All right, so when we're thinking about risk factors, I keep saying this, so let me define what I mean by that. These are the factors that increase the likelihood of substance misuse occurring. I'm going to go ahead and share a video with you on risk factors. It's a quick overview of the science of risk factors. Just to let you know, they talk about communities that care in this video, but the information can apply to any kind of strategic planning framework. So just to let you know about that. All right, here we go.
If you want to prevent a health and behavior problem before it happens, you need to know about the risk factors that predict the problem. What kinds of problems? Well, if a dad asks his son to grab him a beer from the fridge, it's more likely that that boy would be drinking before it's legal age. If a girl hangs out with friends who are using marijuana, she's more likely to use marijuana later. We call those things risk factors. A risk factor is a condition that increases the likelihood of problem behaviors. Understanding risk factors is one of the key foundations of the Communities That Care process. How do we know about risk factors and where did they come from? Well, we've looked at hundreds of studies across 30 years. We've looked for consistency of risk factors in at least 2 well-documented, well-designed studies that follow young people across development. What did we learn from these hundreds of studies? Well, the first thing we learned is pretty much common sense. We learned that children are influenced by every domain they grow up in. They're influenced by the community, the school they go to, their family, and within the individual and their friends. And why is this important to Communities That Care process? Well, it's important because we know that in order to be effective, you have to look across all 4 of these domains. And you do this in order to see where these risk factors are affecting most of the kids in the community, and that's where you want to intervene. The second thing we've learned is that risk factors can be present across development, from prenatal through high school. Kids who are aggressive in 1st and 2nd grade, for example, are more likely to be violent later in life. Or kids who don't have the skills to refuse drug offers in middle school are more likely to get involved in drug use. Why is this important? Because you want to provide preventive interventions across the developmental span. The third thing we've learned is that risk factors predict multiple problems. For example, kids who have low commitment to school and don't value education, they're more likely to be involved in substance abuse, delinquency, violence, teen pregnancy, and dropping out of school. Another example is high family conflict. Now, we all have some conflict in our families, but in families where there's high levels of family conflict, those kids are at risk for a broad range of problem behaviors, including violence, delinquency, school dropout, teen pregnancy, substance abuse, and even depression and anxiety. Why is this important? Well, you get more bang for your buck when you're addressing those risk factors. You can impact not one, but many health and behavior outcomes and really change your community. The fourth thing we've learned is that risk and protective factors operate in a similar way across racial groups and regions of the country. The risk factors are related to health and behavior problems in a very similar way. For example, if you have high family conflict in a Latino urban family, that predicts health and behavior problems. Or if you're a white kid living on a farm in a rural area in a family with high levels of family conflict, that predicts health and behavior problems. So high levels of family conflict is a risk factor, whoever and wherever you are. Why is this important? It means that the science of prevention applies to your community. Now, you may be thinking, the situation in my community is unique. And it is. And this is the reason that Communities That Care is important. It helps you understand the actual levels of risk exposure to these factors that are unique to your community.
All right, now go ahead and pause there. So this gets into more of the Communities That Care piece. But again, as I mentioned before, this applies to any kind of strategic prevention planning process that you use for prevention. So I'm curious to know your thoughts about this video. Anything stand out to you that was surprising or interesting or reinforcing of something you've known but you've forgotten? Love to see you put something in the chat of what did you think about the video? Anything of interest or of note that you would like to, that was kind of a, interesting or reinforcing? What do you think? Nothing too surprising. So risk is everywhere. Yep. Reinforcing that children learn through all areas of their lives. Yep. All right. Similarities and risk factors despite the location or socioeconomic factors. Yep. Great. Lots of great comments here. Yes, and I like Carrie Ann of that. He says it's across all age spans. Yes, absolutely. Risk factors affect everyone. Thank you, Sandra. Yes, absolutely. Absolutely. Thank you for your comments. All right, so today, when we're thinking about risk factors, oops, sorry, that did not go as planned. Let me get back to here. There we go. It took me off to another place. The list of risk factors that we're going to use today, you will find on page 7 in your workbook, and it looks like this. So if you're wanting to refer to it, you can go to page 7 in your workbook. The list that I am using today is from Drs. Hawkins and Catalano out of the Social Development Research Group at the University of Washington in Seattle. So the reason why I like to use this list is it is very evidence-based, science-based, research-based. What they did is they combed through the literature on substance misuse and looking at what things place youth at greater risk of substance misuse. The criteria that they used for this list include these 3 things. In order to be a risk factor on that list, it had to be shown in multiple studies that it was a risk factor. So multiple studies showed the same thing, that yes, indeed, this is a risk factor for substance misuse. Not just one study, but multiple studies. And the studies had to be longitudinal and predictive, meaning they took a group of kids, whatever age group they were studying, who were not already misusing substances. So this was the preventive piece, the proactive in that area. Look at those kids and follow them along and look at what happens in their lives that then we saw that they either did start misusing substances or they did not. So by having multiple longitudinal predictive studies, we can feel very secure in the knowledge that yes, indeed, these are risk factors for substance misuse. The reason why this is so important is if we are building our prevention planning, our prevention efforts around reducing risk factors while increasing protective factors, we want to make sure that these risk factors that we're working to address truly are risk factors. Because if they aren't actual risk factors and we're doing all this work to reduce them in our community, again, remember that 5% amount of funding for primary prevention, we are not going to be using our money well because we are not going to have the impact that we're going to want to have. So we want to be really secure in our knowledge that the information we are using, the list of risk factors that we are using, are actually risk factors for substance misuse. So you want to look, if you have a list of risk factors that you currently work off of, you want to take a good look at those and figure out how was the list created, what criteria was used for it to be on the list. So delve into that some more. And if you can't find that, I would be pretty nervous about using that list. And you might look at switching to a list that does have that evidence-based, research-based component with really strong criteria in terms of being able to be placed on that risk factor list. So keep in mind, as you're thinking about risk factors, this is really important. Be sure to keep this in your mind as we go through this. Risk factors are not causal. Just because it's in a person's life, in a youth's life, doesn't mean they're doomed to this happening, that it is going to have, in fact, happen, that substance misuse will happen. It's increasing the likelihood. It's not a causal relationship. Risk factors exist in multiple contexts. So they happen within our family, within our schools, individual peers, and within our community. So in all aspects of our life. And the impact of risk factors is exponential, meaning if there's only one risk factor in a youth's life, it's not likely that it's going to have an impact, with one exception, which I will point out later. But if there's 2, there's going to start to be a little bit. And then once you get to 4, 8, it's going to exponentially increase the likelihood of substance misuse. So that the number of risk factors, as more are in a youth's life, the risk is going to increase exponentially. All right, one more thing, and then we're going to do a pop quiz. I want to make sure on page 7 again of your handout, you will see in this risk factor list, at the top of it, you will see these different areas of challenges that youth can have: substance misuse, delinquency, teenage pregnancy, school dropout, violence, and depression and anxiety. So what you will see as you are looking through this list, for example, under family management problems, you will see that there are check marks or dots under each of these areas. That means that family management problems is a risk factor for all of these different areas. For another area, availability of drugs, for example, you'll see 2 check marks. So that means that the research has shown, multiple longitudinal predictive studies show that that is a risk factor for substance misuse and for violence. So that's how to look through this this list on page 7 if you're wondering what those dots are all about. But the great thing about this is that as we're doing the work, for example, on family management problems, if we are working to reduce substance misuse by addressing family management problems, we're actually doing the work of reducing delinquency, teenage pregnancy, school dropout, violence, and depression and anxiety. So this is where we can really leverage the work that we're doing to have exponential kind of outcomes in terms of we're going to have an impact in all of these different areas.
Chris, do you see the question in the chat?
Yes, and I am going to, Evelyn, I will get into great details on every one of these. So by the end of this, you should know what that is. And if you can just hang tight, I will definitely explain what it is. All right, thank you for the question, because you're right. I don't expect you to know that yet. All right. Okay, well, let's do pop quiz 1. Risk factors, and here's a poll. It should be popping up on your screen. Risk factors what? And go ahead and select which one. All right, about 10 more seconds. All right, let's go ahead and share the results. We have about 3/4 of you have done this, presented it. All right. The correct answer is increase the likelihood of drug use. Well done. 93% of you got that. So again, they are not causally related. If this is in a person's life, it does not doom them to substance misuse. It's just increasing likelihood. Well done, everyone. Thank you. We'll again stop sharing at this point. Thank you. All right. The question was different for 4. And I'm sorry, I'm not sure what. Oh, I changed the question on the screen from the poll. I apologize. So some people maybe put the 4th one. Yes, so risk factors are not the absence of protective factors. So, yep, you still got it right. If you selected B, increase the likelihood of substance misuse. Sorry for the confusion there. I did not catch that. I did not make those consistent. Sorry about that. All right, any questions before I move on? Anything that has come up before we start going into each of the risk factors to learn more? I see there's none in the Q&A yet. Anything before I move on? All right, why don't you give me a thumbs up if you're ready to move on? This will help me know that you're all ready. Thumbs up or some other emoji. Seeing a bunch. All right, none that are looking like a perplexed emoji or anything like that. So that's good. All right, let's move along then. We are going to start with the community domain risk factors. So community domain, the first one in that is availability of drugs. What we know through research is that the more available drugs are, including alcohol, tobacco, other drugs, the more likely of substance misuse. So the more available, the more misuse. The really interesting, I'd say, piece with this is it's not only the actual availability, but the perception of availability. That's why I put this picture here, is in terms of perception. So youth can just perceive that substances are readily available, and we will see increased use. So they think it's easy to get alcohol. They think it's easy to get tobacco. They think it's easy to get cannabis, whatever it might be. If they just think it's easy, then that's going to increase the likelihood of misuse or abuse for youth. So sometimes it can be difficult to change the actual availability, but if we can change the perception of availability, we can actually have an impact, which I think is hopeful and could be easier at times. When we're talking about availability, we're talking about two different kinds of things. We're talking about social availability and retail availability. The social availability is where youth get substances, alcohol, tobacco, other drugs, etc., from family or friends. So this is within their social circles, that's where they get them. The retail availability, as you might guess, is from stores, from restaurants, from bars, etc. So if we find that there's high availability or even a perception of a high availability within our community, we will want to be able to figure out our youth getting their substances or think that they're easily available, either more the social route or the retail route, because of course that's going to impact what prevention efforts we're going to implement. If they believe it's social availability and that's really the risk factor of what's happening within our community, that's going to be a very different intervention or prevention effort than it would be for retail availability. So when we're looking at addressing that within our communities, we'll want to make sure we learn more and know which it is. All right, so availability, that's the first risk factor. Second risk factor within the community domain is community laws and norms favorable towards drug use. So just as it sounds, it's like what laws are on our books in terms of around substances? There are things that we know that, laws that we know that are in place that, again, lots of research behind these to show the impact as preventative effects. So things like the changing the age to age 21 for alcohol and tobacco. When those laws got put into place, we saw a reduction of use. We know increases in taxes. When we increase taxes for alcohol, tobacco, now cannabis in many states, we see a decrease in use because as the price goes up, we see the use goes down. So those are a few examples of some community laws that we can have in place that can impact substances or substance misuse. Now, the norms piece is a key. We can have the laws on our books, but if the norms within our community that's not really a law that we need to follow or that is important to do to follow, then there might not be the enforcement that's put into place, which will completely nullify the effect of our community laws. So we need to have both the community laws and the community norms not be favorable towards drug use in order to have that preventive effect and to reduce the likelihood of it having an impact. I don't think I phrased that well. If our community laws and norms are favorable toward drug use, restate this. If we see those are favorable toward drug use, we will see an increase in the likelihood of substance misuse among our youth. Hopefully I rephrased that well and did not confuse anybody. Let me know if I did. So with thinking about our norms, I'm curious, how do you see norms conveyed in your community? Go ahead and put in the chat. So thinking about what our day-to-day lives within our community, what are indicators around your community or things that you hear said that are conveying the norms of your community around substance misuse? Absolutely. Billboards, yes. Commercials, posters, signs at gas stations, parties including alcohol, absolutely. Yes. And I'll just say this picture on the screen here of Drink Me to Drive was in my grocery parking lot when I got out one day. And I was like, oh, okay, that's a norm being displayed, right? Yep. Parents allowing drinking at parties, absolutely. You all are spot on. Yes. Exactly. So our norms, if you think about it and start looking around in your community as you're going out and you're listening to conversations, you will pick up on so many messages being conveyed every day to our youth, whether or not we realize it or not. All right. Well done. The other interesting thing is that social norms are reflected in our laws. So the norms of our community, if we feel strongly as a community about something, those are often reflected through the laws that we get passed, the policies, the enforcement, etc. So these norms and laws go hand in hand together. All right. Next risk factor. So we're on to the third risk factor. We've talked about availability of drugs as one risk factor, community laws and norms as the second in the community domain. Next, we have media portrayals of drug use. So we know, again, through research that's been done, that when youth and young adults are exposed repeatedly to media showing portrayals of drug use, so alcohol, tobacco, cannabis, other drug use, when that happens and they're repeatedly exposed to that, we do see an increase in subsequent substance misuse. So, they get the exposure, longitudinal predictive studies, multiple studies, we see subsequent substance misuse. So we are seeing an impact that it is predictive of substance misuse. I'm going to go ahead and show you another video, which can give you an idea of some of the media portrayals of drug use that our youth are seeing.
Must you really smoke?
I love it so very much.
It's shockingly effective.
That sucks.
That next with cigarette?
Really don't mind if you keep me sweating. I really don't mind if you blow me away. I'm trying to keep cool with the way we're going. You're making me melt in your hot, hot flames.
I apologize. Try it again.
Who got a cigarette there? Anyone got a cigarette at the bar?
All right. Now, I realize this is a little old. It was back in 2020 during the pandemic, but I do not believe that things have changed in terms of the amount of media portrayals being done. The research shows that it has not decreased. I'm curious, were there any surprises that you saw in that video? Anything like any of the shows that you were surprised to see that was being portrayed, smoking or vaping was being portrayed in there, or anything else? Any other reactions to the video? Fuller House, yeah. Tracy, absolutely. All right, what any others? Yes, Candy, that was what for me, The Simpsons. I was like, oh, really? Even in there? Not too surprising though, right? Yep, not shocking. Yeah, the amount of kid shows, Stranger Things, yep. Surprised at the ratings, yeah. Like this video, does Truth offer any free online training? I'm not sure about that, Samantha, if they do or not. I have not looked into that. Yeah, that would be interesting to know, Lucas, in terms of if the plot lines portraying it as bad or negative. But I have to say, I'm not. I don't think that would impact it just because we know things like scare tactics and saying that it's bad or different things doesn't actually make a difference in our youth lives with our lack of prefrontal cortex. So I'm not sure, but that's a great question. All right. Yeah, so there were definitely a mixture of a lot of different kids shows and adult shows, lots of different things there. Yep. All right. So when we're thinking about those media portrayals, now this was just looking at smoking and vaping, but think about what other things are they being exposed to that you all put up before around there's billboards, posters, other ways that in our community that that youth are seeing these things. So this is just one small snippet of looking at one way that youth might be exposed to media portrayals of substance misuse or substance use, excuse me. All right. So I'm going to go ahead and move on to the next risk factor. So next risk factor in the community domain is transitions and mobility. So we're going to break these up into transitions and then into mobility. And within transitions, there's two different parts of it. So in transitions, we're looking both at school transitions and community transitions. School transitions. These are both the scheduled and unscheduled transitions within schools. So this is the scheduled ones of going from an elementary school to a middle school to high school. So those are ones that typically in most communities, not all communities, but in most communities, those are the typical transitions. There's also the unscheduled ones where families are moving in and out of different communities and their kids are having to move to different schools because due to being moved. Those are the unscheduled transitions. These all have impacts on our youth. Now, thinking about prevention, are we going to want to reduce that risk factor of scheduled school transitions? Probably not. We are not going to look at changing our school systems. However, that's when we start looking at what protective factors can we really build up and buffer the impact of that risk factor during that transition time. So as they're going from elementary school to middle school, what protective factors can we build into our school systems, into our families, into our individual peers, et cetera? Again, middle school to high school, how can we create some of those buffers? And then for those youth that are being moved to different schools due to their families needing to move for whatever reason, how can we buffer the impacts of those moves? So this is a case where we want to reduce risk factors as much as we can, but sometimes we can't always. So how do we increase the protective factors in these situations? So that's the school piece of the transitions. The community piece of the transitions is a community in transition. So there may be a lot of people moving into a community, a lot of people moving out of a community. And then this could be with mobility, it could be a lot of people commuting from a community. So there's either a lot of people going, like I live in a small suburb kind of town. They're luckily not in my community, but the other communities around are in this area. There's a lot of people that commute up to another city. So when we see this kind of situation where a lot of people are leaving during the day, that really creates a vacuum within a community of what's going on within the community. And it's going to go hand in hand with the next risk factor that I'm going to talk about of neighborhood attachment and commitment. So again, transitions and mobility, we're talking about school transitions, we're talking about communities in transition and communities with high mobility. And yes, Mario, with military families, absolutely look at those. We actually have a recorded webinar on military youth that really looked at that specifically. And this is a case where really building up those protective factors for those military families that are being moved a lot is really important. Absolutely. All right, so like I said, hand in hand, often with communities in high transition and or mobility is low neighborhood attachment and community disorganization. So what we see here is that the less attachment and organization within a community, the greater the likelihood of substance misuse problems within that community. And I want to point out that this is not rooted or anchored in socioeconomics at all. You can have an high income neighborhood that has low attachment and low organization. You can have a lower income neighborhood that can have very high attachment and very high organization. So this is not related to socioeconomics. The key here is that when there is attachment and there is organization, that as problems arise, that community is mobilized to take care of it and is ready to take care of it. So it can be even something as simple as vandalism. There's vandalism that comes in if there's high attachment and high organization, that problem gets taken care of. In a community where there's not that attachment and there's not that organization, that vandalism may stay there for months and months, if not years. Similarly, other substance misuse problems start arising. There's a house that moves in where it's suspected that there might be some drug deals going on within that house. If there's high organization and high attachment, people are going to be watching. It's kind of like I live on a little cul-de-sac, and we had a neighbor at the end of the cul-de-sac whose kitchen window looked straight down the cul-de-sac, and she would keep an eye on what was going on. And if there was a car circling around that wasn't a car that should have been there, she would go stand outside, or she'd be like, "Hey, Chris, do you know this car?" So that was where she was on it, and that kind of thing. It makes a difference to have those eyes and ears open to what's going on and taking care of those problems as they arise. Yes, Jerry, similar to a neighborhood watch program. Absolutely. Absolutely. All right. One last risk factor in the community domain is extreme economic deprivation. Now, this is a curious one, because as I put on here, that there's mixed research results regarding extreme poverty alone being a risk factor for substance misuse. It's often when it's combined with other things such as low neighborhood and community disorganization, low neighborhood attachment and community disorganization, or other risk factors within the community domain. That's when we start seeing that having the impact, or even in combination with risk factors from other domains. So again, looking at socioeconomics alone, I would not hinge our prevention efforts on thinking about addressing that alone. In combination with others, we need to start thinking about it more. All right, so pop quiz number 2. Let's do the next quiz. It's going to be true, false. Reducing the prevalence of community domain risk factors in your community can decrease the likelihood of abuse substance misuse. All right, about 10 more seconds. All right, let's go ahead and share those results. All right, well done, everyone. 98% got that this is true. Often we think about substance misuse prevention for youth that we need to focus on the youth alone. No, we can reduce community domain risk factors and have the same kind of impact. So well done, everybody. Nicely done. We can go ahead. It's already closed out. So now I want to see if there are any questions about the community domain risk factors before we move on. And I see there's one Q&A question. How can you change the perception of availability? Great question. I'm wondering, I bet there's some folks who have worked on that who are in this webinar. How have you changed the perception of availability? Anybody want to share in the in in the chat? How have you reduced the risk factor of availability in terms of shifting perception of availability? What do you think? Anybody done that? So availability of substance misuse. Yep. Oh, I'm wondering, Mario, if you're meaning either social availability or retail availability, which is a great question I should have asked. So here's a bunch of ideas. Social media ads, retail, more compliance checks and roadside stops, increase community education, be the majority campaign. That's what I was looking for more of. So it might be some of those social norms marketing campaigns can often shift those kind of perceptions. Collaborative campaigns across age groups, yep. Would be environmental. Yep, changing the actual availability of how many of the locations. So if they're in areas, retail availability in areas where youth would be. Yep. All right, some great ideas in here. The other thing that I would suggest is there are online registries of effective prevention programs. You could go on there and look at addressing availability and look at some of those that might be that can shift the perception as well. What about availability of firearms? That's listed in my workbook. Is that like availability of drugs? Yes, the more available the firearms are, the more likely that there would be whatever it's lining up for in terms of, I believe that was under youth violence. So, yes. All right. With that, we are almost at the top of the hour. So I have one more poll for you. So we have a new reporting requirement that would be really helpful for for us if you could let us know what funding you use. If you could go ahead, the poll is going to be pulled up here. If you could go ahead and answer that, that would be great. And then once you've answered it, you can go ahead and take your 5-minute break, and we will be back here in 5 minutes. All right, welcome back, everybody. I'm going to go ahead and share my screen here. I'm going to go ahead and end the poll, and I'm going to close that out. All right, if you are back and ready to go, if you could give me a thumbs up emoji or some other kind of emoji, that would be great. All right, we got a bunch of people back. Yay. All right, good to know you're here instead of just starting to talk to an empty screen here. All right. Okay, welcome back for the second half of our risk factors training today, risk factors webinar. But I just wanted to step back a little bit and tell you why I'm taking each risk factor and going into great detail with each one. It's because, again, if we are going to implement prevention efforts to reduce risk factors, we need to know what those risk factors really are, because sometimes the name of the risk factor doesn't give you all the information that you need to know about that risk factor. So while it can be a bit tedious to go through every single risk factor, that is why I'm taking the time to do it, is because it's so important that I'm sorry, I looked over to the chat. I shouldn't do that. But why it's so important for us to know really what those risk factors are, what they really mean. All right, and I see I answered a private question in the chat about when this webinar ends, and I did give the wrong time to that person, so I apologize for that. Rebecca corrected it in the chat, so we've got one more hour to go here. All right, let's get into family domain risk factors. All right, first risk factor in the family domain is the family history of drug use. So there are two different things that we are needing to look at here. It's both environment and heredity. So an interesting piece with heredity is that genetics is about 40 to 60% of a person's vulnerability is due to genetics and other biological factors. So I didn't phrase that well. So let me say again, 40 to 60% of a person's vulnerability to substance misuse is due to genetics and other biological factors. However, and this is really important, however, genetics alone are not sufficient for substance use disorder to occur. So yes, it can place us at greater risk, but again, it's not causally related, it's increasing the likelihood. So that's the family history in terms of heredity, excuse me, is that piece. In terms of the environment, I have a picture here of soil, somebody working the soil, because the soil in which we grow up in which we're nurtured, if we blossom, can be either toxic or nurturing or somewhere in between, many times, right? But we know that the parents modeling substance use, for example, can have an impact. So in their history of use, if the youth are watching the use by parents, that can have an impact. But what's really interesting here with this environment piece is that with older siblings misusing substances, or using in this case, I'm going to say use versus misuse, that's a more powerful predictor of younger sibling use than parent use. So older sibling use is a more powerful predictor of younger sibling use than parent use. So it's that role modeling that's happening by the older siblings. Again, this is not a causal relationship. It's increasing the likelihood, but there are other cases where younger siblings may look at what some older ones are doing, and they're like, "No, that's not what I'm doing. I'm going to go the opposite way." So again, not causally related, but it's just increasing the likelihood. All right. Let's go on to the second risk factor in the family domain. So this is the one I mentioned up front when we were looking at the full list. So family management problems, what do I mean by that? I like to use the acronym GMC. It helps me remember. We're talking about guidelines, monitoring, and consequences. So guidelines are do our children know what things they should be doing, shouldn't be doing? Is it very clear what the behavior is that is expected of them? Are there clear guidelines about what they should be doing, what they should not be doing? The monitoring is, you can have all the guidelines you want within a family, but if they aren't monitored, then it's all for naught, right? It's kind of like having those community norms at the community level, or excuse me, the community laws at the community level, but no norms to back them up, no enforcement happening. Similar at the family level. So we need to have clear guidelines, we need to have the monitoring, and then there are the consequences. So with consequences, we're talking about if excessive consequences is when we get into family management problems. So the extreme of that is, of course, child abuse, but it can go all the way to even, if there's an infraction of the guidelines within the family, and then there's an excessive consequences, like there's a minor infraction and they're what's it called when you can't leave the house for a month? You are, I've lost the word. Grounded. Thank you, Lucas. Exactly. You're grounded. So you minor infraction and then you're grounded for a month. That would be an excessive consequence for a minor infraction of not following the guidelines. So when we're looking at family management problems, there could be a lack of guidelines that exist, or there might be the guidelines, but there might not be any monitoring, which falls into the neglect area. If you're looking for child neglect, it's falling within that column. And then if there are excessively harsh consequences, that's when we get into the consequences column of the family management problems. All right. So guidelines, monitoring, consequences. 3 pieces of family management problems. Family conflict. Now, I don't know any family that doesn't have any family conflict, but what we're talking about here is the extreme family conflict. And it can be either conflict between the parents, caregivers, or it can be between the parents or caregivers and the children. So it's that extreme level of conflict that causes this to increase the likelihood of substance misuse. Now, again, the extreme end of the continuum of this can be domestic violence. So if you're looking for where does domestic violence fit in on this list of risk factors, it would fall under this risk factor. And the last risk factor in the family domain is favorable parental attitudes towards drug use. So I have a couple of examples of messages that would be conveyed in this situation of, kids will be kids. I did it when I was young. I'm just fine. They're going to do it anyway, so I might as well have them do it at home where I can monitor them. Those kind of attitudes, interestingly enough, actually can increase the likelihood of substance misuse. So as parents, we have to be extremely careful about what attitudes and thoughts about kids' use that we are conveying to our children. All right, and Danita's saying, I've seen so many screenshots of parents' comments like this on Facebook. Yep, I'm using for parents. Exactly. So as we learn about these risk factors, and you really digest of what they really are, you will see them more and more as you're looking at things across the media, the comments within in different community groups, or you're talking with your friends and you're like, let's not be saying that. So absolutely, we see these all around. Yep. Okay, any questions before we move into our next pop quiz? Any questions? So I see Mario says, what if parents give their kids small monitored doses of alcohol as they get older, so alcohol is not seen as rebelliousness? That was the common thoughts and knowledge, especially like the European model. People often refer to that. But research has actually shown that is not helpful, that is not a preventative effect. So thank you for asking that, Mario. Yep. All right. So let's go ahead and go into our next pop quiz, another true false. Divorce is an example of a risk factor in the family domain. All right, about 10 more seconds. All right, let's go ahead and share our results. All right, the correct answer is false. I want you to go back and look at that list on page 7 in the family domain. Do you see divorce listed there? I realize this is kind of a trick question, but an important trick question because, as you'll see, we're going to talk about some things that are not risk factors. Divorce in and of itself is not a risk factor. It's when other things are happening that are within the family domain that it can be a risk factor, but it's not a risk factor in and of itself. And I will talk about that a little bit more. But so we often think about different things going on, and we assume for different reasons that it is a risk factor. But again, we need to go back to our risk factor list and see what multiple longitudinal predictive studies show our risk factors for substance misuse. And yes, people are mentioning ACEs. Yes, and I'm going to get to that. I promise you, because yes, I know it is an ACE. So we will talk about that. All right. So let's get into our school domain risk factors. School domain, first risk factor, academic failure beginning in late elementary school. So this is a key piece of this is the age. So if children are falling behind for any reason in grades 4 to 6 or later is when academic failure becomes a risk factor. It's going to increase the likelihood of substance misuse. What we see is if there's academic failure starting in grades 4 through 6, that they get this label of failure kind of gets stuck to them instead of it being like a Post-it note that we can take off in earlier years. It's like super glued onto them that this label of failure gets internalized, gets stuck with them. But we're finding through research again that before grade 4, if children are failing for any reason at all, there's time to recover. So if we are doing preventive work, our primary prevention work to address academic failure, the ideal time would be before grade 4. It would be early childhood, kindergarten, first, second, third grade. That would be the time that we could have the preventive effect to prevent this risk factor from having an impact. All right, next risk factor in the school domain. It is lack of commitment to school. So with this, it's interesting that what we see is that there's an inverse relationship between the time spent on school activities and drug use. So the more involved youth are in school, in any kind of activity, that we see an inverse relationship with substance misuse. So it could be being involved with different academics types of things. It can be very committed to academia. It can be involved in the chess club. It can be involved in the band, music, acting, sports. All the different kind of activities related to school has an impact. So we want to create that commitment, that attachment to school in order to not have this be a risk factor within our youth's lives. All right. Oh, we went really fast with that. I want to ask if there are any questions before we get into our pop quiz. So we have the three, just two in the school domain. We have the two risk factors in the school domain. We have academic failure beginning in late elementary school, and we have lack of commitment to school. Any questions there? And I see there's one in the chat. I don't see any in the Q&A yet. What if youth get treated as a potential failure because they're bilingual? So that, let's see, I'm trying to figure out. So what if youth get treated as potential failure because they're bilingual? So it would be if they were, yes, if they got the label of academic failure, then that's where it would have the impact. Again, for whatever reason. It could be, yeah, because English isn't their first language and their school is being taught in English. Could be because they have a learning disability. It could be because they have a lot of absences because of things going on at home. It could be for whatever reason, but if they're failing, if they get that label of failure, that's where it has the impact. Yep, and a lack of commitment to school. I think, Mary, attendance would be an indicator of a lack of commitment to school. Absolutely. All right. So what do you do in entire communities where commitments to school is not a priority? Fantastic question, Kelly. Any thoughts for her about if you have seen in your community that where school is not a priority, anything that you have done? Any suggestions from you all? We have a big group here, so I bet there's some folks who have addressed this within their community. Any thoughts? Any thoughts? PBIS programs. I'm not familiar with that acronym, Sheila. Do you mind spelling that out? Incentives for attendance. Yep, other purposeful commitments, caregiving, sports, safe hobbies. Yeah, so if school's not where it's happening, maybe we increase protective factors in the other areas. Absolutely. After school clubs and programs, community liaison. These are excellent suggestions. Positive behavioral intervention system. Okay, great, thank you. Or in supports. It looks like a couple of different ways to say it. All right, great ideas in the chat there. So with that, I'm going to go ahead and go on to our next pop quiz. Our next pop quiz is an ideal time to address the risk factor of academic failure is. All right, about 10 more seconds. All right, let's go ahead and share the results. All right, correct answer is grade 3 or earlier. So why is that? Why would that be the ideal time? So an ideal time to address it is because before grade 3 or before grade 4, we can unstick that label of failure. It's still a Post-it. All right. Once we get to grade 4, that's when it gets internalized and it gets stuck in kids. And that's when we see the impact of that risk factor. So if we want to address the risk factor of academic failure, we need to do it early on. Now, do we not want to help kids who are having problems after that? No, absolutely not. But again, I'm talking about if we are wanting to do substance misuse prevention work, this is when we would do it ideally. All right, thanks everyone. All right, sorry, just a second. I see a couple of questions in the Q&A. So we have this as a risk factor, but have a high achievement school, so I'm confused why there is a lack of commitment to school. That's really interesting. That would be where I would have to delve into it. If I were you, what I'd be inclined to do is to do some focus groups and really delve into it because that is an interesting thing. You would definitely need to dive in deeper to get an answer with that. All right, and the next one is there such a thing as being too involved in school, like too many activities? Some of our kids talk about being stressed with commitments and doing well in school and using substances to escape the stress. I have not heard about that as being a risk factor. So I'm not sure about that, Candy. I haven't heard that as a risk factor. So sorry, I don't have an answer for that. All right, let's keep moving along. We have one more domain, and that is the individual and peer domain risk factors. So let's dive into this area. First one is early and persistent antisocial behavior. So this is two separate pieces here. And the first one is early antisocial behavior. Now it's curious with the research, what they found that this is only with boys. It's not that the girls weren't studied, but it's just that with boys in kindergarten through third grade who showed antisocial behavior, this is when they showed an increase in likelihood of substance misuse later on. So when we're talking about antisocial behavior at this age, it's often like if a boy is very shy and withdrawn and then explodes in anger, or it could be not getting along with peers, getting into lots of fights with peers, etc. That's that early piece. With persistent, this is both boys and girls. So when we're getting to older ages, these are things like truancy, shoplifting, fighting, etc. So those are the persistent antisocial behaviors that I mentioned in this risk factor. So both the early and the persistent. All right, alienation and rebelliousness. With this piece, these are those youth who don't feel connected to society, to their community. They often value nonconformity. They don't see a place for themselves in society. So, as this yellow bell pepper, just really feeling like they stand out and they don't fit in at all to the rest of the community. So that's the alienation and rebelliousness piece. Gang involvement. This is probably no surprise to anybody here, but if a youth is involved with gangs, they're more likely to use alcohol and or other drugs and to engage in delinquent and or violent behavior. So that's probably not a surprise to anybody. Peers who use. So do you remember long ago, back at the beginning, when I talked about the risk factors have exponential impact, that if a youth has one risk factor in their life, it's not likely to have an impact, but two, we start seeing it go up. If they have four in their life, there's the exponential increase. And I said there was one exception of a risk factor that if there's one in their life, that it can have an impact, and this is the one. So if they are hanging around friends who use, peers who use, this can have an impact on them. It's going to increase the likelihood of substance misuse. So it's one of the strongest predictors of substance misuse. But still not a given. We're still talking about increase in likelihood. So just because this is there, it's not a given. And it's interesting, I had my oldest son, who's now 23, was hanging around a youth who I suspected was not making really great choices. And so I was monitoring it very closely, and we had discussions with my son, about the behavior of this other youth. I did a lot of monitoring because I just really did not trust what was going on. And sure enough, a couple of years later, my son wasn't hanging around him as much, but he then started having a lot of problems around, I believe it was mostly alcohol, but I'm not positive all of it. Ended up going into treatment as a junior or senior in high school, and happy to report he's doing great now. He's my son's age, he's doing wonderfully. But what was really interesting is when he came back from treatment, my son was the only friend that he was allowed to spend time with, because this youth friend group, all the rest were using substances. So again, the power of the peers who use as a risk factor definitely it is the strongest predictor. All right. Next, favorable attitudes towards drug use. What we see here is, and what's important to know, is that a shift in attitude precedes a shift in behavior. And this is true for adults, for youth. This is just part of human behavior, kind of in terms of the psychology of human behavior. We have to, as humans, have a change in attitude about something that we think something is good, okay, it's not going to hurt me, whatever it might be, before we exhibit that behavior. Same with when we're talking about substance use or misuse. There has to be that shift in attitude that it's okay to do, it's not going to hurt me, I'll be okay, etc., before we see that behavior. And what's interesting with this is in general, we see this shift going this shift from elementary school to middle school to high school. So middle school, you go and talk to some elementary school students. You say, what do you think of doing drugs? You would often get the reaction, oh, gross, I would never do it. If my friends would do it, they wouldn't be my friends. That kind of an attitude. You go to middle school, same question. What do you think about doing drugs? Well, I would never do it, but I know so and so did it and they were okay. So, so we start getting that ambivalence more so in middle school. And then high school, it's a whole nother story. So when we see these attitude changes in each segment of life, and what we want to try to do is, in a development appropriate way, we hope that they keep the elementary attitudes of ooh, gross, yuck. If my friends did it, they wouldn't be my friends. We want to prolong that as much as we can and really keep those attitudes towards drug use as unfavorable as possible. Because again, attitude changes precede behavior changes. Okay. Next, early initiation of drug use. So some key ages here. Research shows that those who drink before age 15 compared to those who wait until after age 19 are twice as likely to misuse drugs. So those who drink before age 15 compared to those who wait till after age 19 are twice as likely to misuse drugs. This is a really impactful one. So it's like, if we can just delay that onset as much as we can, we have a preventative effect. This goes back to, also ties into the parental attitudes where kids will be kids. They might as well do it here where I can monitor them. I had a friend who had been in recovery for probably 15 years, and I was talking to him, I can't remember what we were talking about, and he mentioned with his teenage daughter, who at the time was 16 or so, that he was just like, well, I'd rather have her, if she's going to drink, I'd rather have her do it here where I can see her. And I gave him this information around this, if we can delay the onset from 15 to 19 or later, that we're going to have this preventive impact. And that blew him away. He had no idea. So this is that if we could get this into common knowledge amongst our community members, our parents, our schools, all of those, if we just at least delay the onset, it can have a huge impact. All right, last risk factor. Are we ready for the last risk factor? It's constitutional factors.
Chris, there are a couple of questions that pertain to this last factor.
Sure, thank you for saying something. Are they in the Q&A?
Yes.
Okay, thank you. Okay, what about those who begin drinking between the ages of 15 and 19? So again, it's increasing the likelihood as the age goes along. So if we can delay, even to 17, it's going to be helpful. If we can delay to 18, even more helpful, but 19 is ideal. So it's going to increase the likelihood each year earlier that it's going to happen. Can you clarify where the statistics came from? I believe in the last two slides of your handout are citations. So the citations, you can look through those. I don't remember exactly the research study that one is related to. If you want, I can include that in the follow-up email, but I don't have that off the top of my head. And then, are there ready-made materials educating on delaying the onset? Can we quote studies? So similar thing. So I'll look at that. Okay. And it says, I partially answered his question, Mario, how could we prolong the negative attitudes? Use, for lack of better term, scare tactics has always been effective. It has not been effective. So I'm wondering if you're saying not effective. And I strongly encourage you to come to the next webinar in this series is what does not work, because we have shown that scare tactics has not worked. So yeah, I had a feeling, Mario, that you were missing a word. That I had a feeling. So great, thank you. All right. Thank you, Rebecca, for letting me know there were questions. All right, last risk factor in the individual and peer domain, constitutional factors. So these are the biological, physiological things within our body that have an impact on substance misuse. So it's things like brain trauma, either at birth or later in life due to accidents, things like ADHD, low basal rate. There's different things. Again, you can go to the research and get a deeper dive. What is important here is that we can't necessarily have an impact on those things that, if the brain trauma has already happened, there's not a lot we can do to reduce that as a risk factor. But this is a key point where if we know that there are, there's a segment of the population or individual use that have this risk factor, that's when we really want to bolster those protective factors and reduce as many of the other risk factors in their life as possible. So this is a situation, we can't necessarily change this situation, but we want to pay attention to it and we want to increase those protective factors around them and reduce the other risk factors. All right, ready for another pop quiz? Here we go. Pop quiz number 5. The risk factor that is the strongest predictor of youth substance misuse is? What do you think? All right, 10 more seconds. All right, let's go ahead and end this poll, share the results. Friends who use drugs, well done. 62% of you got that one. That is the strongest predictor of youth substance use. Well done. All right, now, before we get into the things that are not risk factors, we need to make some room in our brain. So we're going to do a quick dance break energizer. So you ready? I encourage you, as you're able, if you can stand up and move around, that'd be great. If not, just sit in your seat. Let's get our body moving so you'll be ready for a little bit more information. Here we go. Oops, sorry, just
Chris, there's no sound.
Is that working yet? Rebecca, can you hear me?
Yep, we're not hearing the music. Why don't I play it?
Okay, thank you.
Mm-hmm.
It's not letting us play it at all. I can't hear it either. Well, Zoom just is not wanting to play. All right. Well, I would like everybody move something. Stand up, move around, do something. I know that little bit I just moved my body. If you can move your body a little bit, just, yeah, give a thumbs up or something if you've moved your body at least a little bit. Sitting here for this long is really hard, and it's hard for our brain to keep absorbing. Okay, thank you. At least some people moved around. Why would it stop working? I have one more video. Hopefully it will play for that. All right, let's go. I'm going to go ahead and share my screen one more time. Actually, let me move on to the next slide to make sure we get this right. Okay. I'm going to do it one more time in a different way. All right. Oh, and Rebecca, I think I know what happened. I think, can you select with share to select, or here, I think I can undo it. Can you select? Nope, I did it. Okay, you all, I think I figured out the problem. I think I clicked something a little earlier that undid it. Sorry, so I think it's going to work next time. All right, here we go. I'm glad to know this will work. All right, some things that we know through research are not risk factors. Here we go. Boredom. We often hear, well, kids are just bored. If we can just keep them busy, then we'll prevent substance misuse. Not the case. What we know is that when kids are bored, it's what's going on around them that's going to impact what's going to happen. If they're hanging around friends who use, guess what they might be doing? If they're in a place where there's high availability of substances, if there's parental attitudes favorable towards drug use, et cetera, et cetera, et cetera. If those things are going on when there's boredom that happens, then yeah, probably substance misuse is going to happen. However, if those risk factors are not present in their life and they're bored, maybe they go out and do something productive. Maybe they go out and play in the dirt. They go out and get a hobby and do something else. So it's not the boredom in and of itself that is the risk factor. Not a risk factor, divorce. This was one of the pop quiz questions. What we see with divorce is it's not in and of itself a risk factor. In some cases, divorce can be helpful in reducing the number of risk factors in a youth's life. So if there's extreme family conflict in the family due to the parents or caregivers, having extreme conflict, and the divorce or separation reduces that conflict, that can actually be helpful. Maybe there's a parent who's actively using, has a substance use disorder, and by being separated and away from that parent, that's reducing that risk factor. So it's not the divorce in and of itself that is the risk factor. It's what else is going on in the family. And I'll get to ACEs in just a minute. I know that was a question. Another one, not a risk factor, is low self-esteem. So this is another area where they studied different programs, strategies that increase self-esteem. And in that research that was done, they researched to see the impact on substance misuse, and they did not see it having an impact on substance misuse. So we often talk about, we just need kids to feel better about themselves. Yeah, that's an important thing to do. But if we're looking to prevent substance misuse, increasing self-esteem is not in and of itself going to be a preventive effect. All right, average childhood events, or ACEs. I know that you all had a question about this. So not all of the ACEs are risk factors. There are some that a lot that overlap, but not all that do. For example, parental separation, divorce, as I just said, has not shown to be in and of itself a risk factor. Household members being incarcerated. Again, by having a household member incarcerated, that might reduce the risk factors that youth is exposed to within the family. So ACEs can help predict substance misuse in the future, but it's not useful as a planning tool. So our goal, for example, our goal in prevention isn't to reduce divorce, the number of divorces, is to increase family management, it's to decrease family conflict, it's to do those things that we know will have an impact on substance misuse. Hopefully that's helping. However, something that ACEs can really help us with is identifying those youth who are at higher risk. That, for example, if you're familiar with the Institute of Medicine classifications of prevention, if we're looking for selective populations to address with our prevention programs, ACEs can be a great way to identify those who would be ideal to bring into our programs and to help implement prevention programs with them. So I know that there's cases where many times ACEs is on a list of risk factors, but ACEs are not equivalent to risk factors. In some cases they are, but not always. So I hope that's helpful. And I see there's, let's see, I think that's really, there's a question, but it looks like that's relating to something else. So there's positive childhood experiences as well, and those are related more to the protective factors pieces. And so that was definitely, there's that piece as well, Jerry. Thank you. All right, any questions about that before we move on to take action? All right, I want to make sure to get to the next video, which I think is going to work now. So we're going to move into take action. And I want this video, it does a great job of really pulling together risk and protective factors and how we can put that into action in our work. So go ahead and play this.
So one of the questions that I get asked pretty regularly, especially when I was younger, was how did you turn out okay? You had sort of a difficult upbringing, child impacted by substance use disorders. When I get asked this question, very simply, the answer is it's science. This is not a miracle. It is not magic. It was science and counterbalancing all of the risk factors that I came into life with protective factors. So if you think of it as a seesaw, I had a lot of risk factors on this side of it coming into this world and for about the first 10 years. But then there were things that happened, interventions and people that cared about me that counterbalanced that seesaw to put protective factors on the other side. So it not only leveled out, but it went in the opposite direction. And I think it's really important for us to remember that no child is unsavable, right? Regardless of the risks and the home life and the difficulties that our children are faced with because of addiction, because of substance use disorder, that we have the science and the tools to intervene and help to improve their outcomes. When we talk about why some people develop a substance use disorder and some people don't, I talk about the triangle, sort of the three main factors. And at the tip of the spear is genetics. We have about 50% of the individuals today that have a substance use disorder have a genetic predisposition, right? We pass this down to our loved ones, and you can't control that. But what you can do is know that you have a genetic load, that you have risk factors because of your genetic predisposition, like I do. So because of that, and knowing that I have 4 generations of addiction before me, I know that I have higher genetic risks than, let's say, my next door neighbor or my best friend. So I make choices that counterbalance that. So that's on that genetic side. And then on the other side of the triangle, you have environmental factors. It's about the community that you come from, the environment that you live in, things like poverty level, crime level, availability of substances in that community. And we know that there are interventions that can impact that, the norms that we create in communities. And then you have the individual side, right? That's things that are unique to me and unique to my family and my household. Parental monitoring, really clear expectations that are set forward, positive adult relationships, all these protective factors on the individual side that also have correlating risk factors. But how we address those, particularly for all the kids that are impacted by substance use disorder, is critically important. So I come back to that teeter-totter. I came in to this world with probably every risk factor that you can account for, both on the genetic side, the tip of the spear, the environment I lived in, and my individual factors. But I rebalanced that by the interventions, things like delaying the onset. I did not drink till I turned 21. And even till today at 41, I am very careful about alcohol consumption, intermittency, and being careful about my own use. Clear relationships. I had not only my grandparents and aunts and uncles that engaged as caring adults in my life, but was given a a mentor through our county behavioral health services when I was just a kid that helped with another caring adult mental health care. I was court mandated to see a psychologist when I was 8 and continued that care to make sure that I had the mental health treatment that was necessary to deal with the trauma, the adverse childhood events, and those risk factors that needed to be addressed. We even know how to prevent this illness for those that have the most risk factors for developing this disease. And we just need to make sure that we're deploying them to every community.
All right. So with that, I'm curious, what risk factors and protective factors did she mention in the video? Go ahead and put in the chat. What did you hear from her that the risk and protective factors that were in her life? Anything that you picked up on? Genetics in terms of the family history? Absolutely. Delay of onset of use. Wasn't that interesting, Carrie Ann? Yep. And Leah, yes, that she waited till age 21. Yep. Caring adults for those protective factors. Yep. Access to mental health treatment. That is something that was, in terms of making sure she's being able to deal with those ACEs that she had to impact in terms of those pieces of her life. Yep. Court assigned mentor. Yes, somebody to be on her side, that positive mentor, that person who would be there for her. Yep. Great. You picked up on a lot. So I just love the way that she reminds us that just because risk factors are in a youth's life does not doom them. It's not causally related. We can reduce the risk factors. We can increase protective factors and have a positive effect. And again, going back to what we're doing, we're working on primary prevention. We're working on preventing things from ever starting, preventing substance misuse from ever starting. And we can do that through reducing risk factors and enhancing protective factors. Are you going to go through the rest of the day hearing my voice with that? All right. So if you use a strategic prevention framework in your prevention work, where do those fit? Those fit in many places, risk factors do. In the assessment piece, we're going to want to collect data on which are the priority risk factors that we need to address within our community. Within our planning process, we will need to plan what prevention efforts, what prevention interventions we can put into place to reduce those priority risk factors. And of course, we're going to want to implement those strategies with fidelity and and then we're going to want to evaluate how did we reduce those risk factors through our prevention efforts. So in many areas of the strategic prevention framework, we will focus on risk factors. We need to make sure that we are addressing those risk factors with multiple strategies in multiple ways, while of course increasing protective factors. Implementing one program to address one risk factor within our community likely is not going to have a huge impact. But if we can work with others within our community who are doing different types of preventive interventions, if we can look across the program that we're implementing in and of our own thing, are we implementing multiple strategies addressing multiple priority risk factors within our community while increasing protective factors? That's when we're going to start seeing the impact. I wanted to point out this resource from the Pacific Southwest PTTC. They have a document on where you can find effective strategies for substance misuse prevention. So once you've identified your priority risk factor, I highly recommend that you go to one of these registries and search by risk factor to find out what strategies have been shown to be effective at reducing that risk factor. So we'll go ahead and put this will be in the follow-up email. It's in your workbook. It's in these PowerPoint slides. So one way or another, I highly encourage you to download and look at this resource. All right, possible next steps. Now, once you log off of here, within about an hour, you will forget probably 50% of what I've said, which is very sad, right? But there are ways to help prevent that loss of knowledge. And I have some suggestions for you of things you might be able to do. One thing I highly recommend is that you have a chat with a colleague about this, or it could be your partner or your children or a neighbor, whoever it might be. But the more you can share with somebody and verbalize what you've heard, that's going to help cement it within your brain. I highly recommend that you examine the risk factors your organization uses to see what criteria was used for that list. Is it evidence-based? Where did it come from? Was it put together? Look at, if you've already completed a needs assessment, look to see what the data showed about priority risk factors. Was data collected on risk factors? Check that out. Explore the prevention strategies, a prevention strategy to see if it addresses one or more of your priority risk factors. So go use that document from the Pacific Southwest PTTC to look at those online registries. Watch the recording of the Building Protective Factors webinar if you did not get a chance to sit in on that. Again, explore evidence-based registries. So I kind of had that twice, but you can do it in different ways. And if you are available and interested, I encourage you to register for the What Does Not Work webinar on January 7th, the next webinar in this series. I would love it if you would be interested in submitting what action you are going to take. And this is going to be put in the chat, a link to this Google form of what action will you take? And I'm going to go ahead and go back one. So if you can't get to the Google form, you could just go ahead and put it in the chat. If you want to put your name and email address on that Google form, I'll check with you in 24 hours to see how it's gone with what you've committed to doing. So feel free to add that in. All right. Give people a minute to do that. And I'm going to finish up with a few closing thoughts here on upcoming events. All right, we have some folks putting in the chat. Thank you. And there's also that commitment form if you would like to do that. Seeing lots of chats with colleagues, which is great. Reviewing risk factor chart, love it. Love seeing all this, thank you. All right, few closing thoughts. Make sure I get you out of here on time. Upcoming events. As I mentioned, the What Does Not Work is coming up on January 7th. We have Selecting Evidence-Based Strategies, so looking at what does work, on February 5th. And our last one in this series is Logic Models on March 10th. Coming up on December 9th, just next week, believe it or not, is using generative AI, artificial intelligence, in your substance misuse prevention work. Brian Klaas is going to be delivering that webinar, as well as the one on December 16th that's going to build off of it, is leveraging AI chatbots for substance misuse prevention data analysis and reporting. If you're interested in connecting with other preventionists, substance misuse preventionists, we encourage you to sign up for our networking events. We have another one coming up on December 17th and then January 21st. This is very informal. You get sent into breakout rooms with some discussion questions and just time to chat with other preventionists. We have an interesting training coming up on Beyond the Generational Divide, really looking at the different generations working together in our prevention workplaces. This is for intermediate and or advanced level preventionists. That's going to be a 2-hour interactive training with breakout rooms on December 18th. We have a few more slots left in our SAPS course, our virtual SAPS. It's going to be in January. And then also we have our Prevention Core Competencies training, also virtual in February. Priority is given to Region 5 folks for both of those because we have limited slots. I want to make sure you know about our Prevention Learning Portal. This is part of our website where we have information on different topics, and we do have a Risk and Protective Factors one. So if you go in there, you click on Risk and Protective Factors, you get to this page. There's on every page, there is what is it, learn about it, and take action. So if you're wanting more ways to take action, and or learn about it, go here. If you haven't already, we'd love to have you follow us on LinkedIn and Facebook. If you're a social media kind of person, this is the way we get information to you on a daily basis. And last but not least is our Gipper evaluation form. If you could please take a couple minutes to let us know how this webinar worked for you, both what worked and what, if I did it something differently, would have made it better, that would be great. I read every single comment, so please know that as you're filling it out. And with that, Rebecca, anything else before we log off for today?
I am not seeing anything. There were a couple questions in the Q&A. Do you want to do that in the next 2 minutes, or do you want to do it in a follow-up email?
I'll go ahead and write up the responses and send that out of the follow-up email.
Wonderful.
Thanks. All right. Well, everyone have a fantastic rest of your day. Thank you to Rebecca and Alyssa for being on the back end to help us have this go so smoothly. And a huge thank you to you all for your active involvement. I really appreciated it. It makes a huge difference for you to actively involve in the chat and the polls and different things, so I know how it's going for you all. Hope you have a wonderful rest of your day. Take care, everyone. Bye-bye.